Newcastle disease, caused by Newcastle virus NDV, belonging to the Paramyxoviridae family. Symptoms: the disease can cause symptoms in the respiratory system, digestive system, and nervous system. Common symptoms include cough, difficulty breathing, runny nose, diarrhea, reduced egg production, paralysis of legs and wings, convulsions, and a high mortality rate of up to 70 to 100%. Lesions, lymph nodes in the large intestine swollen and bleeding, hemorrhage in the gastric gland. Prevention: the disease is caused by a virus, so there is no specific treatment, so regular vaccination is the most effective prevention measure. At the same time, it is necessary to ensure hygiene of the barn, spray disinfectant on the barn periodically, limit contact with wild birds, and quarantine newly imported poultry before entering the herd. Periodically provide supplements and multivitamins to increase poultry resistance. 2. Bird flu, caused due to influenza virus, mainly H5 and H7 strains. It is a dangerous infectious disease and must be declared an epidemic and destroyed when poultry gets sick. Symptoms: avian influenza can be highly fatal and spreads rapidly. Symptoms include fever, decreased appetite, decreased egg production, edema of the head and crest, diarrhea, bleeding of the leg skin, and rapid death, and high mortality rate can be up to 100%. Prevention: the most effective disease prevention method is vaccination, controlling the spread through isolating and destroying infected poultry, regularly cleaning barns, and limiting contact with wild birds. Disinfection: periodically use disinfectants. When a disease is detected, it must be declared an epidemic and destroy the entire poultry herd. 3. Disease IB, infectious bronchitis, reason. The disease is caused by coronavirus RNA virus. It is a very serious acute infectious disease in poultry, especially in chickens, causing huge economic losses. The disease occurs all year round and in all ages in chickens, with an incidence rate of 50 to 100%, causing death 0 to 25%. Symptom: when chickens have respiratory problems, they have typical symptoms such as chickens are moody and have poor appetite. Sick chickens huddle together near a heat source. Coughing, sneezing, wheezing, stretching your neck to breathe, and yawning. Chickens have severe diarrhea, green stools with white and slimy moss. High mortality rate, sometimes up to 70 to 80% in chicks. Chickens are susceptible to other factors such as CRD, ORT, immunodeficiency, poor cage ventilation, etc. For laying hens, the number of eggs decreased by 10 to 60%, the rate of deformed eggs increased, soft shell, distorted, rough and no shell, etc. The hatching rate decreased. Laying hens often have drooping buttocks and drooling. Prevention: good disease prevention hygiene, regularly disinfect the barn, farming tools, sprinkle lime powder, keep the barn always dry, clean and airy, minimizing stress for the chickens, especially during seasons and transitions cage. Preventive vaccines are the most effective method to prevent. Choose vaccines from reputable brands and absolutely comply with the vaccine schedule depending on your local epidemiology to choose the appropriate vaccine line. For Gumboro disease, cause: Gumboro disease is an acute infectious disease in chickens, but mainly in 3 to 6 weeks of age in turkeys. Caused by the infectious bursal disease IBD virus. They affect the Fabricius pouch, causing immunodeficiency. Symptoms: young chickens infected with Gumboro disease often have diarrhea, thin, watery, white, slimy stools, dehydration, weight loss, ruffled feathers, and high mortality rate. The chicken turns its head toward the anus to peck and scratch. During surgery, severe bleeding on the thigh and chest muscles. The far sac hemorrhages, swells or shrinks, the kidneys swell with urate, etc. Prevention: for viral diseases, the most effective method to prevent the disease is still vaccination, and at the same time clean the barn periodically and disinfect to kill pathogens and control the spread of viruses. Provide supplements and vitamins to increase resistance for chickens. To prevent and control diseases in poultry, pay attention to cleaning, disinfection, and vaccination. You can use antiseptic products such as iodine or Dion Super, which are safe antiseptic products to use in the presence of animals. At the same time, periodically adding supplements and multivitamins to increase resistance for poultry, especially when the weather changes and seasons change.